It's the top of the hour. Welcome back on the AM show. It's a fitting time for me to share my blunt thoughts with you, and today I've titled it, Healthcare Up in the Air, Ghanaman Wahala. Healthcare up in the air, Ghanaman Wahala. You know something, Ghana, for? The more I contemplate, the more I think about Ghana, the more Ghana fails to make sense to me. And today I'm going to elaborate on a number of matters to do with our premier hospital in this country, the Korle-Bu Teaching Hospital. From roads to the renal department to equipment that is not functioning and what that means for our healthcare. And then you will understand that there are problems, deep-seated, deep-rooted problems in our country. And sometimes they make you wonder who is thinking in this country. But let me give you a bit of history. The Korle-Bu Teaching Hospital was established on the 9th of October 1923. The facility was built under the administration of Sir Frederick Gordon Gaggisberg. We all know him from the history books. Then the governor of the Gold Coast as a general hospital to attend to the health needs of the people. It has grown from an initial 200-bed capacity to 2,000. And as some reports say, it is the third largest hospital in Africa and the leading national referral center in Ghana. But why focus on Korle-Bu today? Well, for myriad reasons. Come with me and you'll understand why. For starters, I want you to watch this video and the slides that will follow. They will situate the first end of my conversation. Those, Ghana, for are the roads leading to the premier hospital in Ghana, from the Bukum Boxing Arena to the polyclinic, is terrible. Just from the traffic light from the ICGC to STC can take you over 20 minutes. Imagine having a medical emergency and having to be driven on any of these stretches. You'd probably be dead before you get any medical attention. So how did we get here? The bad roads are not for Korle-Bu to fix. That is not within their scope of work. That's up to Kwesi Amoako-Attah, the roads minister, to deal with. And just for the sake of clarity, this is not something to talk of a big contract to do. 1 or 2 days of night work should fix this. There's already a contractor on that stretch constructing that extension. Why not let that be done in addition to it quickly? 1 or 2 nights of work, I'm told by experts, it's all that is needed. But while Korle-Bu's authorities are not expected to build roads, they are expected to do certain things, which brings me to the second aspect of my concerns about Korle-Bu today. So yes, you've seen the roads. But then we get into the Korle-Bu Renal Unit. Recently, we've been talking about dialysis treatment. The OPD was shut down for 5 months and 11 days because of a debt of 4 million Ghana cedis. Now, the authorities say the renal unit owed 4 million cedis, and it was only open to renal patients yesterday. Yesterday, the 2nd of November. Do you know what that means for these fellow Ghanaians who suffer kidney disease, among others? Do you know? It's like a death sentence. Only yesterday, for 5 months. Let's go to the next slide. But here is what 4 million Ghana cedis really means. It can buy 5 Land Cruiser V8 vehicles at a unit cost of 800,000 Ghana cedis. And how many of them do we see? How many of them, just sacrificing 5, could take care of this at Korle-Bu? It could construct only 6 kilometers of road from Weja toll booth to the Kaswa overhead. Yet, for some reason, we cannot raise this money and people are dying. Next slide. According to Gifty Labi, member, Renal Patients Association, this is what she says. We see death every day. Every day, our fellow Ghanaians see death because of irresponsible leadership. This is happening. Now, in terms of the next angle I want to look at in terms of this conversation, I've spoken about the roads, and I'm hoping Kwesi Amoako-Attah will do something about them, because you cannot have a road like that. No ambulance will take you speedily to the hospital. You may die. That's the reality. We've spoken about dialysis treatment, the renal department, and the woes, but I will shock you with what I'm about to show you next. Some crucial equipment at Korle-Bu has not functioned in a while, and guess what? Wahala no day. People could die on the back of those. I'll explain to you before I come back and elaborate. The MRI, magnetic resonance imaging machine at Korle-Bu, there's only one in Korle-Bu. It's a 1.5 Tesla, it has 1.5 Tesla magnetic strength. The cost is $1.5 million. It has worked for only 3 months this year and is currently not operating because of a power problem. $1.5 million worth because of a power problem. It's not operating. And later, when I give you a breakdown of what these equipment do, you will understand better. Next slide. Another piece of faulty equipment, the CT, computerized tomography scan machine. There's only one in Korle-Bu. It's a 640 slice machine, one of only 3 in Africa. One of only 3. It's good that we have it. The cost is $1 million. It has not functioned for over 2 years due to a faulty tube head. 2 years. Where can country be this? 2 years. Next slide. There's a CT scan machine. It's a public-private partnership. That's a 32-slice machine. The cost is $60,000. It developed a fault over a week ago, and it's still not operating. And let's go to the next one. We'll talk about the mammogram machine. It cost $100,000. It developed a fault over 3 months ago. It's still not functioning. And the general problems that we're seeing here attributing to all of this, a lack of maintenance, that is one. And 2, there is no maintenance agreement on any of the machines. I ask, how can we live like this as a country? We say Agenda 111, but look at the state of the nation's premier hospital. Our misleaders act sometimes as though they had screws loose upstairs, but they don't. A lot of the time, these things happen because of the deals they cut. Who will get what building contract? Who will get the wiring contract? Who will get the medical supplies contract? Who will get the kickbacks? We talk nowadays about the great things the University of Ghana Medical Center is doing and the top-notch services they are offering. Fine. It is worthy of note, however, that even the UGMC refers cases to Korle-Bu. We have people coming from all over the West African sub-region to seek medical care. Call it health tourism at Korle-Bu. That should tell you just how important this facility is to not just our national life, but that of the sub-region. But I keep telling our misleaders, routine checkups you will go for abroad and you'll be fine. The private facilities may help you, but the day you face an emergency and you have to use our public healthcare systems, that is when you know what the ordinary man faces every day. Recently, I had to go to RIG, the Greater Accra Regional Hospital. Someone was sick. You will not even get a bed. The struggle you will go through. Oh my word. But just to break down what this means for us, talking about lack of maintenance and then no maintenance agreements on the machines, I want to give you a breakdown of what these machines actually do. We also know that patients have to travel long distances to access these examinations, first of all. The adverse effect of these things not working, patients have to pay more to access these examinations. There's the inconvenience associated with moving critically sick people to these places outside the hospital. Not to talk of the impairment of teaching and learning in a teaching hospital. Korle-Bu is a teaching hospital. But the uses of the machines I just mentioned, let me break them down for you. The MRI, it scans various parts of the body for diagnostic purposes. It helps evaluate in great detail the soft tissue structures of the body, like skin, your brain, your heart, abdominal organs, muscles, etc. It's essential for babies and pregnant women who cannot be exposed to radiation produced by the CT scan. They are too, fragile for that to happen. That's just that one. The CT scan. It scans various parts of the body using X-rays for diagnostic purposes. It helps evaluate in great detail, like I mentioned, the soft tissue of the body, emergency diagnosis, among others. Let's get to it. Also is used for critical cases like strokes and road traffic accidents. Now, the mammogram. It is used in the scanning of breast tissue in great detail. We've just come from Breast Cancer Month. It is essential for detecting early onsets of breast cancer. This is the state of our premier hospital, #1 in Ghana, and this is the state. 4 million, renal department. That's how many, four-wheel drives. How, sometimes I don't get it. How can we live like this as a country? Does this make any sense to you? I'm sure some people will be out there, and you're always criticizing. Does this make any sense to you? Does it? Does it? If it does, then maybe I should stop this. But if it doesn't, then we need to talk about it. Because, you know what? I'm not sick today. Who knows what could happen to me tomorrow? I'm not sick today, but maybe you could fall ill any moment from now. Sickness doesn't discriminate. I'm not sick, but maybe someone close to me falls sick. And they may have to go through that and die an unnecessary death. Poor road, lack of equipment, malfunctioning equipment, no maintenance, and people are dying. My name is Benjamin Akakpo. This is what I do. I expose the things that our misleaders don't want exposed, things that are problematic, so that you and I can have a better Ghana. These are my blunt thoughts shared with you, raw, hot, and edited, undiluted. As always, I pray, may God bless Ghana and make her great and strong.